So today we are going to talk about one important topic, that is pancreatitis. Pancreatitis, very important topic. So basically we have pancreas. Okay, okay. So basically these are already we studied in GIT, the anatomy and physiology, that this we can do have two works, endocrine and exocrine. Means it have two functions. One is for hormonal, which have insulin, alpha, beta, delta, everything is there. Cells are there, so insulin, glucagon, okay, etc. And another function is exocrine for digestion, okay. So pancreatitis mostly whenever affected, okay. So its exocrine functions are affected, okay. This is the thing we have to remember. It may be due to the artery which is sending the blood, purified blood, having any clot, thrombus, or any infection itself in the pancreas. Okay, pancreas itself having any infection or any trauma, any accident, any uh, trauma which affected the pancreas to degenerate itself or damage itself, or any rupture happened to the blood vessels, so leakage of blood into the pancreas which occurs, which happened infection, okay. So mostly it anything will happen, anything is the reason. And other in the social habits, what we have alcohol, ethanolic. A person is alcoholic, okay. If a person is alcoholic, so then the pancreas may be damaged due to the toxicity of alcohol, which damage liver, along with liver, pancreas. But these are the things. And another thing is that gallstone maybe also leads to pancreatitis. So we have three to five types we discussed here. Any thrombus artery, any infection itself in pancreas, any trauma, alcoholic, or gallstones. So these are the reason behind the infection in the pancreatitis. So what will happen? First, the infection will spread to the pancreas, and you can see the swelling. Okay. After swelling, what will happen? The tiny capillaries tiny capillaries will broke because of the swelling. The capillaries will rupture. Second thing will happen. Third thing is that after rupture, what will happen? Blood will split, blood hemorrhage will happen. Then what will happen? The cells present in the pancreas will become necrosis because of the not spreading the oxygen, not getting the nutritions to the cells of pancreas, mostly exocrine part. Okay. So this will happen. So what will happen after necrosis? What will happen? You can have the fluid accumulation, pus, everything will come into the pancreas. What will they do, doctors? Doctor will remove the pus and give the antibiotics. Sometimes they will cut down the necrosis part and remove from the body. These things will happen. So this is the pathological part which I explained. Swelling, capillaries of rupture, capillaries will rupture, hemorrhages will happen, necrosis will happen. After that, pus will form, then fluid accumulation, and the stomach will become heavily. Okay, okay, these are the things will happen. Now, what are the clinical features? Very important. Clinical features. Basically, in anything will happen in the abdomen, we have abdomen pain or abdomen colic. Okay, pain in abdomen. Okay, this is the first sign. Mostly left lower limb. Okay, mostly mostly left side. Okay, left side abdomen. Second is that the main uh, clinical features of vomiting. Whatever the patient eat, he will expel from the stomach. Anything. Sometimes it will be food, mucus, gastric juice. Okay, all this thing will be expelled out with severe severe pain. Okay, sometimes in severe cases, breathing difficulty also will come. Okay, and very difficult situation in severe condition, the patient will also die. Okay, toxicity will happen, and toxicity after toxicity, it will spread all over the body. Okay, septicemia will happen to the body. Okay, so these are the things, clinical features. So what are the lab tests you can advise? USG, abdomen. Okay, serum amylase, because of the pancreas will digest the fat, lipase. Okay, and you have LFT also, liver function test also you have to do, and CUE, because of the, if the patient is alcoholic, you can have to see the liver function also. So these are the things we have to see. Okay, if these are the positive signs, we have to see, treat the patient with pancreatitis. So what is the remedies? We have the basic remedy is S2L1BE. In the place of S2, you can use S5 also because of the metabolic remedy. Okay. Next, we have to improve the digestion, to improve the, to treat the infection. Okay. We have C5 Ver1G. Okay. In place C5, C2 can also be taken. And the third one is we have S10WE. Okay. And for have vomiting sensation, you can advise the patient S11. In this is D6. All this in the D4 because of the, initially you can start with D5, then go to the D4. Okay, gradually. This is very good for us. And the fifth, you can advise for application S5, C5, F1, Word 2, G or W. Okay, local application S5, C5, F1, Word 2, G. Okay, all in you can have to read D4. Okay, if there other than this condition, these are the clinical features. Along with the clinical features, we are giving the treatment. Other than, if the patient have any other symptoms, you have to approach with the symptom. First, any treatment initially. approach with symptomatic, because initially the patients have lots of symptoms. Okay, when you treat the patient 15 days to 1 month, every symptoms will go out from the body. Then the only main symptoms remain. Okay, if the main symptoms remain, it will advise, it will guide you to the main problem, main area where the problem is related, and as well as you can advise start the patient the temperament. These symptoms also will give temperament related issues. Okay, here the organ is also be treated, here temperament also be treated. Okay, first you have to approach with symptoms, then the main symptoms, then the temperament. So this is a cycle. Okay, you can treat the patient in 3 dimension. Okay, this is a top symptoms, all symptoms. This is a second dimension, we have main symptoms. If a patient have in the pancreas, vomiting, abdominal pain, indigestion, flatulence, constipation, everything is there. So all that symptom based treatment you given. Second, they have only abdominal pain. They doesn't have vomiting, indigestion, anything. Main symptom is abdominal pain. Means in the pancreas there is infection. That's the reason there is a pain. So now focus on only pancreas. Third is along with the pancreas, now you have to give the temperamental remedy. Okay, this is the 3 dimension treatment. Okay, if the temperament is disturbed, again symptoms will arise. Okay, again symptoms will arise. The patient will have the problem. Okay, so these are the treatment plan according to the condition. We have to treat. Word one is also we are giving. Word two is given. So someone asked that if you are giving, oh, it doesn't have antibiotics in the electrohomeopathy here, but we have organ remedy. What we have? We have organ remedies. Means the remedy which heals the organ and cures the organ. Okay, it means it have any infection also, it will treat. It have any structural problem, it will heal. It will, it have functional issues, it will heal. Okay, so that's the reason we are calling uh, organ remedy, organ based remedy. In okay, like we have liver remedy, male remedy, female remedy S2, S3, S5, bone remedy C4, lymphatic remedy L1, blood remedy A1, A2, A3, lungs remedy P1, P2, P3, P4, likewise. Okay, so we have to remember that if any patient occurs, you have to start the treatment with that remedies. Okay, so this is all about in today's class about pancreatitis. Hope you understood. Thank you. If any doubts, kindly ask.